The Canadian Medical Association has a new president. 40 years old, he's not only one of the youngest doctors to fill that role, but also the group's first Indigenous president. Sean Cowan caught up with him earlier today and spoke with him about entering this role at a time when healthcare is facing some significant challenges.
The first one, I don't know if I ever told my parents this, maybe the first time they heard this, but they always thought that I was just joking when I said I want to drop out of medical school, but I literally almost dropped out of medical school in the second year of classes.
Meet Dr. Alika Lafontaine, the new president of the Canadian Medical Association. Yesterday he joked about how he almost gave up, but now he's entering a new role at a time when a lot of healthcare professionals are leaving the industry.
It used to be that you'd have one nurse for 4 patients. It's normal to have one nurse covering 12 patients now. You know, it's getting to the point of actually being ridiculous when you go into work and you realize that you are literally the only person providing care for all these very, very sick patients.
Dr. Lafontaine says Canada is at a breaking point and things need to change. He's calling on the government for more pay and less administration work for doctors and nurses so they can concentrate on patient care.
So in another year, if we don't change our trajectory, things will just continue to get worse. I am hopeful, though, that we're at a point where we feel like we have to change. And I think you are starting to hear that language from governments across the country. You know, you always reevaluate your priorities when you realize that your past priorities don't work anymore for the situation you're in.
Dr. Lafontaine was born and raised in Regina, Saskatchewan, and started his career in Saskatoon. He is the first Indigenous president with the Canadian Medical Association.
You know, I bring in a different lens and a different type of experience. I think one of the things that I've really realized over the last year is that I know which voices are excluded. You know, people talk to me differently because I come from a different lived experience. And whether it's because I'm Indigenous or whether it's because I'm a rural specialist or whether it's because, you know, I was someone who grew up in, you know, a small town Saskatchewan, you know, my dad coming from a farming community of Lestock. You know, all these things work together to create a different environment for people to talk and discuss.
And Dr. Lafontaine says one of the biggest things he would like to see return is that personal relationship between patients and doctors, something that he says was lost during the pandemic.